Good morning, Tommy. Today we're going to cover different ways to use your meter-dosed inhaler, also known as your pump. When you use an inhaler by itself, the medication comes out at a high speed and some of it hits the back of your throat and stays there. The spacer will help you get the medication deep into your lungs, rather than stuck on your tongue or the back of your throat by breaking it into smaller droplets. This way, it is easy for you to inhale more of the medication into your lungs.
Okay, so how do I use a spacer?
The following instructions will show you how to use a spacer.
A spacer is known as an aerochamber, and it's a holding device that allows for the medications to more easily reach your airways. It is recommended that all inhalers should be used with a spacer. If you do not have a spacer, please ask your doctor to prescribe you one. A spacer will come either with a mask or without a mask. When you are using a spacer with a mouthpiece, follow these steps. Remove the caps from the inhaler and spacer. Shake the inhaler for 5 seconds before using it. Then, insert the inhaler into the spacer. Spray the inhaler, and within the next 2 seconds, place your lips on the mouthpiece. Take a nice, deep, and steady breath, and try to hold it for a count of 10. After taking the first puff, you should wait about 30 seconds before taking the second puff. If it's a controller medication, one that should be used every day on a regular basis, you should rinse and spit after using to prevent mouth infections. The following instructions will show you how to use a spacer with a mask. Using inhalers through a spacer with a mask is the usual method used by children, but can also be used by adults. Follow these steps if you're using your inhaler through a spacer with a mask. Remove the caps from the inhaler and spacer. Shake the inhaler for about 5 seconds before using it. Then, insert the inhaler into the spacer. Place the spacer's mask over your nose and mouth, making sure a seal is created. Press the inhaler once to deliver 1 puff, 1 dose, into the spacer. Slowly breathe in and out through the mask for a total of 6 breaths. Wait at least 30 seconds between doses. Repeat the above steps for the second puff. If you do not have a spacer, it is also important to know how to use your inhaler properly by itself. Follow these inhalation techniques without using a spacer. First, remove the cap. You then need to shake the inhaler for about 5 seconds. It's best if you first exhale and blow air out, since this will prepare your lungs to take a nice big breath. Once you put the mouthpiece inside your mouth, you need to make sure your lips form a seal around the inhaler mouthpiece. Then, while pressing the inhaler, breathe in and hold your breath for 10 seconds. Then you should breathe normally and wait at least 30 seconds before the second puff.
The more you learn about your condition, the better off you'll be.
I had no idea there were so many ways for me to take my medicine. Have a good day, doctor. See you next time.